Welcome back, Blue Train Riders. Okay, so we are going to talk about the lymphatic and the urinary system today. So let's get going. Okay, to get us started, we're going to talk about the immune system. So remember, the immune system has 3 lines of defense. The first line are your surface barriers to try to keep things from getting inside your body at all. The second line are going to be some generic innate, meaning you're born with defenses that you have. You'll attack everything the same way. And the third line, if they get past both of those, then our immune system, actually the immune proper system, comes into play. So the innate immune system, innate means that you're born with it. So you are born with surface barriers like your skin, saliva, acidic surfaces, cilia, mucous membranes, all of those things. Phagocytic cells you are born with. They eat up and gobble all kinds of invaders. Antimicrobial proteins, like we talked about the complement system, it works in both the non-specific and the specific defenses. We talked about interferons, that's another antimicrobial protein. Interferons make it so that viruses can't reproduce. We talked about fever. So fever, remember, the job of that is to make it so that your body is holding on to iron so that bacteria can't reproduce. And it also allows your body to heal more quickly. And then the inflammatory response, which brings plasma and white blood cells to an injured area to hopefully destroy foreign particles. So here's all kinds of things that might infect your body, and you're going to treat them all the same way if it's a non-specific defense. So if it's a specific defense, your body will treat fungus different than bacteria and different than parasites. So that's the difference there. Maybe we should have talked about the 5 organs of the immune system. So first of all, you have your spleen, which houses leukocytes and also breaks down old bodies, old cells. Tonsils and adenoids, again, like lymphocytes, they're going to filter lymph. So white blood cells will go there with the foreign bodies that they're containing. Thymus gland, you saw that in the pig just above the heart. It was really large in the pig because it's a fetus. It's still developing its nervous system. Its immune system. T cells are made in the thymus gland, so it would be very active because it's trying to come up with its immune system. And then Peyer's patches, which are found down in the intestines. Okay, look out, I'm trying my hand at some new tricks I'm learning. So with immunity, you have your non-specific and your specific defenses. You have an active and a passive response, and you can respond artificially or naturally. So let's talk about those. So first of all, the non-specific defenses. The non-specific defenses, like I said, they're going to just attack everything the same. So most all of your innate immune responses are going to be non-specific. So that would be your skin, mucous membrane, cilia, pH. You have antimicrobial proteins in your saliva and in your tears. So all of those, inflammatory response, fever, yada yada. Specific defense, as you can see here, that's the 3rd line of defense. So it's going to attack every individual pathogen differently. So lymphocytes and antibodies are responsible for the specific defenses. And then your defense can be active. If it's active, you are making your own antibodies. If it's passive, they are transferred to you from somebody else. So you're actively involved, you're making the antibodies. If it's passive, you're passive. You're just letting things happen. So they're given to you either from your mom or from another individual. So we use antiserums for things like Ebola, things that are fast acting and going to kill you really quick. So that would be passive. And it's also artificial because you didn't come by it naturally. It was on purpose. Whereas the placenta, antibodies will cross the placenta as well as in your mother's milk. Not that you're drinking it anymore, but anyways, antibodies are passed to the infants and the fetuses through those avenues, and that would be natural because they just happen to come upon them. With active immunity, you're developing your own antibodies, so you're in charge of that. So that can be natural or artificial again, and it's natural if you just happen to come in contact with the flu, the kid next to you sneezes, wipes his nose, and then it's on the table, whatever. Yuck. Or you force it. That's going to be artificial. Anytime you force something, it's artificial. So vaccines are going to be both artificial and active because you forced it and you made your own antibodies. So the way a vaccine works, you want to know that. So it's a weakened pathogen that's injected into your body. So your body notices it, goes through a primary response. So it says something doesn't belong, and it learns that shape, and it makes the antibody that matches it, so that if you're exposed to it a second time, you'll recognize it and you'll already have memory cells that will attack it. The components of the third line of defense, which is your specific defense, are the B and T cells, or the lymphocytes in general. So the job of the B cell is humoral response. So any infection that is in the extracellular fluids. So interstitial fluids in between cells, the plasma, the cerebral spinal fluid. If there's an infection in there, that's the job of the B cell to recognize it and create antibodies. The antibodies will then bind to the antigen and make it easier for a phagocyte to find it, eat it, and destroy it. The job of the T cell is to take care of cell-mediated responses. So if the cells themselves are infected, the T cell's job is to destroy those cells. So first of all, you have these helper T cells. They're the ones that are affected by AIDS. So helper T cells, over here we have a helper T cell. It's going to have an antigen presented to it, either most often from a phagocyte. So a phagocyte eats the bacteria, for example, breaks it down, and then pieces of it get stuck on the surface, and then the helper T cell binds to it and decides if it's self or non-self. So if it's non-self, it starts releasing interleukins and calls the B cells to come and take care of it if it is in the extracellular fluids, or it calls all those are B cells. It calls a killer T cell to come to the rescue, and the killer T cell is the only cell that can directly kill any of your cells. So if your cell is infected, it's going to get rid of your cell. If your cell has become a cancerous cell, it's going to get rid of that cancerous cell. If you got this wonderful kidney from your friend and they don't match, it's going to kill those kidney cells. So that's the job of the killer T cell. And then helper T cells and B cells can both make memory cells. So memory cells are like photocopies of the cell that has that specific shape. So the specific shape recognizes the antigen or the pathogen, the foreign invader. So then if they get infected a second time, then you already have plasma cells that can automatically form. Plasma cells are the ones that make the antibodies, or you have killer T cells ready to respond. 3 problems with our immune system that we talked about were allergies, autoimmune disorders, and AIDS. So AIDS, we spent lots of time talking about AIDS, and you've heard of AIDS before. So acquired immune deficiency syndrome, you probably should know what that stands for. What it does is it attacks your helper T cells, which, as we know, are the ones that coordinate your immune response. So by killing off your cells and making more of themselves, they destroy your immune system, and then you're more likely to catch infections that you typically wouldn't catch. Autoimmune, auto means self, right? So you're immune to yourself, or you're creating an immune response to yourself, I should say. So over here are some examples. We used, I don't know what happened. We used rheumatoid arthritis as an example. So you probably should recognize that one on the test because we've talked about that one. Multiple sclerosis is another common example, and I believe that one was talked about in class as well. So that's when your cells start attacking your own cells. So with rheumatoid arthritis, it's attacking those cells in your joints, and you get all tangled up looking. And then with multiple sclerosis, they're attacking those Schwann cells, on the outside of your nerves. So that makes them go a little haywire. Allergies, those darn sneaking allergies, it's just an inappropriate response. Your body is overreacting. They say you're hypersensitive, kind of like I am sometimes. I'm hypersensitive and I overreact. So your body is reacting to things that shouldn't kill you, like that mold really shouldn't kill you. That pollen, not so much. Nuts, that should be protein, darn it. So unfortunately, our body recognizes those as foreign and sometimes attacks those and creates a bad response. So those are really all the things that you need to know for the immune system. So this is a real weird transition, immune to a urine, but we're jumping into the urinary system. One of the things you want to know is the functions of the urinary system. Anytime you have a list of things you have to learn, you can probably expect to see questions like all of the following except. Okay, so learn the list. So what it's most known for, obviously, is filtering blood. So it's removing waste. It could be toxins, it could be extra medications or vitamins or nitrogenous waste specifically. Regulates your electrolyte balance. Usually we're talking about potassium and sodium, because we know that those are needed for neural transmissions. But it also talks about magnesium, calcium, chloride. If you just know potassium and sodium, you should be fine with any question that comes across related to that. Regulation of the acid-base balance. So we talked about alkalosis and acidosis. You're not going to see those crazy words, but just recognize that it keeps your blood's pH in its 7.35 to 7.45 range, and therefore it's taking care of homeostasis. It regulates our blood volume. So with blood volume, we're talking about how much water is in the blood, and that is directly related to blood pressure. So do you say that it indirectly controls blood pressure? Maybe. It regulates a number of things outside of filtering. So we not manufacture vitamin D, but turn it into its active form, which allows calcium to help out bones. And then renin, which is part of that angiotensin mechanism, so that's going to take care of blood pressure as well. And then EPO, which you might remember, makes red blood cells in the bone marrow. So all of those things are the jobs of the kidneys. Down here, we're talking about the characteristics of urine. So urine has a clear to straw yellow color. It's slightly aromatic. Some might say it smells like ammonia, and that's really not the urine itself, but it's the action of bacteria on the ammonia or nitrogen substrates that are in the water. It is clear, not cloudy, and then has a typical pH of 4 to 8. Remember, the foods that you eat can affect that. Vegetables is going to lean towards the basic, and proteins are going to lean towards the acidic. You don't really need to know that. Typically, your urine is around a pH of 6, so it's slightly acidic. Okay, we're going to talk about the anatomy of the pieces and parts of the urinary system. So first, of course, we have the kidney over here. So the job of the kidney is to filter the blood, and then it has 3 layers. So this outer region right here, this is the cortex, and the majority of the nephron, the functional unit of the kidney, the majority of the nephron is found in the cortex. And then portions of it, including the collecting duct, are found in the medulla. So here we have the medullary pyramids. So their job is going to kind of collect all of the urine that was formed. And then they're going to drain through the calyces, but we don't need to know those specific parts. We want the big overall picture. So they're going to drain into the renal pelvis, and the pelvis then is connected to the ureter, which sends urine on its way. This is kind of a cool picture over here that shows the 3 layers. So you can see the cortex, the medulla, and the pelvis right there. Let's do that again. How about the cortex, the medulla, and the pelvis right there? Okay, over here we have the nephron. So the nephron itself is in the purple. And then you have the collecting duct over here is in the yellow. So just technicalities, I guess. You have the renal corpuscle, which is made up of the glomerulus, and the Bowman's capsule. So this is where filtration is occurring. This is going to show up on the next slide, so I'm going to talk about the filtration process next. You have proximal convoluted tubule. That's hard to say. So proximal means that it's close, right? And convoluted means it's twisted. Not all pictures show it twisted, but it should be. So you have the proximal convoluted tubule. And then you have the loop of Henle, which looks like a loop, so that one's not too hard to remember. And then you have the distal convoluted tubule. So if you remember from chapter 1, distal means furthest away. So that's the twisted tube that's furthest from the glomerulus. Okay, so the last piece, technically not the nephron, you have the collecting duct, and that's where the final adjustments to the urine filtrate are made. Physiology, how does it do what it does? So how does the kidney, or the nephron more specifically, make urine? So there's 3 steps to urine formation: filtration, reabsorption, and secretion. So filtration is a non-selective process. Up here in the glomerulus, you have anything that fits through the holes of the capillaries. The glomerulus is the capillaries, so that's the blood supply. Anything that fits through those holes are going to enter the Bowman's capsule. After that, we move into the proximal convoluted tubule, and we start to reabsorb things that our body needs. What does our body need? Amino acids, glucose, water, calcium chloride, sodium, all those things that our body has a use for. We need glucose for energy, amino acids to make proteins, calcium for muscle contractions, sodium to move water from one compartment to another. So those things are going to be reabsorbed. That's a selective process. So only the things that fit certain carrier molecules will be able to cross the membrane. Let's see, the third step, secretion. Secretion is going to happen in the distal convoluted tubule for the most part. So we're going to resecrete. So we filtered everything, we took some things back, now we're going to put things back into the urine again. So we're going to resecrete things that our body doesn't need. So any of those nitrogenous wastes, what are those? Creatine, urea, uric acid, ammonia, all those things contain nitrogen, and we don't want too much nitrogen in our body. Hydrogen can make our blood rather acidic, so we usually are excreting hydrogen so that we can maintain that proper pH. Sodium's being reabsorbed, so potassium's being secreted. Remember, they go in opposite directions. So potassium will be secreted as well as any toxins or medications that are unused, vitamins that you have too much of. Those are all going to be resecreted. And then something that can affect water's reabsorption and sodium's reabsorption is aldosterone. So aldosterone is a hormone. So it's made somewhere else, travels through the blood, goes to the kidneys, and opens up sodium channels. So sodium will be reabsorbed and water follows salt. What's that? Water follows salt. So by reabsorbing sodium, you reabsorb water. Don't confuse aldosterone with antidiuretic hormone. So antidiuretic hormone only has to do with water. Antidiuresis means against urine formation. So that just has to do with water and nothing about salt. So this is our last slide. Giddy up. So we have just a couple vocabulary terms, kind of miscellaneous to talk about. First of all, incontinence. Incontinence. I don't know what happened to my picture, but it was a picture of a bladder that just couldn't hold its urine. Quite often that happens in youngsters because they don't have control over their muscles yet, and it happens in the elderly because you get weak and they can't control their sphincters either. The other time you might experience incontinence is just when the bladder is too full and it just can't hold it. So then the other thing that you should know is just some fluid types. So we talk about intracellular and extracellular fluids. So intracellular, the word intra right, inside cells. So intracellular is inside the cells. So basically we're talking about cytoplasm. Extracellular, extra, outside of the cell. So here we have extracellular fluid all around the cell. That's called interstitial fluid. You also have extracellular fluid floating around in your vessels, so blood. And you also have it in the lymphatic system, in vessels, and you also have it in your cerebrospinal fluid. So I remember a question that we had on our test where we had to match the proper term with the proper fluid compartment. So if it said cytoplasm, you would recognize intracellular, and if it said plasma, you would recognize extracellular, right? And then incontinence is just a memorized fact. So in means inability, and continence, maybe you see control in that picture. So inability to control your urine. So that's it for the urinary system. We are almost done studying for our final exam. And tomorrow we'll talk about the pigs, and then we'll be done. Fire up.